Hi, I'm Julia, and that's my cat Icky inside who wants to come out so bad. And today I'm talking about natural approaches to treating mental health, which is what I'll be doing when I start at my practice in about 2 weeks in San Diego. Yay! It'll be fun. Um, and the good news about this is that I knew there had to be more when I first was diagnosed with OCD. I was told there was therapy and antidepressants, and I was too scared to do the antidepressants, and it took a while to get into therapy because I just wasn't ready for it for a really long time. But there's more that can be done, and I never did do SSRIs. I did do a lot of therapy, but I did do what I'm going to be talking about next, and it's been really life-changing. Because people couldn't even now I tell people what I used to be like, and it really is hard to imagine. I still have days where I get a little bit flared up and triggered, but that's what therapy was for me. It's for handling those moments, those spikes. And that's really what mental illness is. It's psychological inflexibility, not being able to handle life for many reasons. Feeling like anxiety comes on too quick and too strong and too fast, or depression comes on too quick, too strong, too fast. Influenced by perfectionism, low self-esteem. This all leads to behavioral stuff like eating disorders, addiction, sleeping too much, or not sleeping enough. Even schizophrenia, forgetfulness. There's so many things that can happen. And therapy does a great job at handling this. It really does. Teaching coping skills, learning stress management, and to tolerate some uncomfortable emotions, to talk ourselves back down to a grounded place. And I was really lucky because not everybody has that access. It's hard. I found somebody who I really liked, a therapist I really liked, who was taking patients, who took my insurance, who was familiar with my condition. All these things lined up, and that's really not always that common. But I will say, more often than not, it's not just psychological inflexibility that's creating a manifestation of psychological symptoms. It's also something biological, whether that's IBS or GI-related stuff, because we know our neurotransmitters are made in the gut, a lot of them are, or hormones being all haywire or imbalanced, like a thyroid dysfunction, traumatic brain injuries, genetic predispositions, medications causing nutrient depletions, infections, chronic inflammation. There are so many things that can contribute to those manifestations, because not everybody will have symptoms identical to somebody else because of the same thing. It seems like that because when we think of something like strep throat, everybody gets a sore throat. But when we have different combinations of different things going on in the body, like something psychological and something biological, it can just come out any which way it wants. So it's important to treat both things, to do some really good investigation with some thorough testing and find out what's going on with the person. And more often than not, someone who's got psychological symptoms and with the biological underlying condition, they're also going to have neurochemical imbalance. People say, I just don't make serotonin. I've never had enough dopamine. That's probably all true. So we need to figure out the proper way to target those neurotransmitters with the right amino acid combinations to get things back in balance. And what's really interesting is you could take 500 people with anxiety and look at their amino acid panels, and every single person would look completely different. And that's why it's not as simple as giving everybody 5-HTP for anxiety. It's a little bit more individualized and customized, because the other thing is we can't just give everybody a multi-amino acid supplement. There has to be ratios, and the receptors and activations get really complicated, so it's best to find out exactly what's going on and make sure you work with somebody who knows how to properly target those. Because just like a symphony, where one musical instrument is kind of off and somebody else compensates to try to fix the sound and it gets kind of swirly, that's how amino acids work too. So, and they have relationships, so we have to know exactly how to gently manipulate them so everything comes back into balance the way it should. But there's a lot of other tools as well. Nutrition is really the foundation of it. We know sugar, alcohol, caffeine, food sensitivities, all these things can influence how we manifest with inflammation or whatever, you know. It's like anything else, you know, like if you hold tension, not everybody holds tension here. Some people hold it in their back. It can go anywhere. Like I hold it in my jaw, like I grind my teeth. So wherever the body wants to push a symptom out, it's going to go that way. So it's important to find out, and I'm just sort of jabbering now, but back to what I was saying. There's some other really cool stuff we can do, like botanical medicines. Different herbs can be so supportive and also nutrient repleting at the same time. And that can really help not only with symptom management, but also to correct certain things that are going on in the body as well in a more gentle way. Neurofeedback's kind of fun. So it's like cables all over the head, like leads, and there's an EEG basically that shows the brain waves, and it helps to train the person to speed up or slow down their own brain waves. So cool. It's kind of like learning to regulate your breathing, but it's like brain waves. I love it. So it seems like a lot, like, oh, I have to worry about the psychological stuff and the biological stuff and support the symptoms, but actually, again, it is like a symphony. So even though the whole thing can sound crazy, it might just be a few things, instruments that need tuning, and maybe just tuning one or two. The others will stop compensating, and then everyone just sounds musical and perfect again. It's great. So, and this is just a third option. You know, there's more. There's way more. But this is the program that I find to be really effective. And gentle, which I think is so important. And it's about the individual, you know, because we all have our own healing journey that's going to take the time it's going to take. For some people, like me, it was virtually overnight, you know, and for some people it's longer. And it can be really scary, but it can get so much better. So I'm really excited. I'm gonna make some more videos about more things. And if you have questions, obviously, please let me know. And I'm excited to get things going because, you know what? None of us are alone. So stay strong.